the abdomen now, and that's the pancreas. I have, similar to the morning, very similar layout. We're going to use the audience response liberally. 6 or 7 modules to go through. Would like your input, but recognize that due to time we may not get a lot of direct questions from the crowd, but I'm going to use you well through the audience response system. If we really book through things, I'll have open mic for a question or two for the panel throughout. So the objective of this afternoon is to cover the 3 major pillars of pancreatic surgical practice. We'll have modules on malignancy, on cysts, and one covering the full spectrum of pancreatitis. There will not be any fascinomas. This is not a stump the professor process, but rather we want to gain insight from our distinguished panel as how they would approach both common decisions that we make, as well as how they would handle some challenging management issues. Hopefully we'll be focusing on some of the current themes and quandaries that we don't have definitive consensus on yet. Please get your audience response triggers ready. We're going to use them liberally, and at this point now we're going to queue up the process where we're going to identify who our panelists are and who the audience is. So if you're a panelist, follow number 1 right now, and if you're in the audience, number 2. Okay. It's my pleasure to introduce a very esteemed panel today. We're proud to provide such an international flavor to you, including cosmopolitan New York City, France, Canada, Scotland, and even Eastern Philadelphia. To introduce the group, we're going to move on. I'm going to ask you for the first group here today. Dr. Carter, could you please cleanly define what constitutes resectable pancreatic cancer? No more and no less.
Non-metastatic, locally limited disease for which you can achieve a minimum of R1 margins by local resection.
Dr. Pedrosa, our radiologist in-house today, what is your radiology opinion on what is resectable pancreatic cancer?
Well, so I think we'll learn the hard way that there's no such a thing as a resectable pancreatic cancer on imaging, because even when we don't see any locally advanced disease, probably about 15-20% of patients will have unresectable disease. But in general, if we see a tumor that's confined to the gland, away from the main vessels, SMA, SMV, hepatic artery, and no evidence of invasion in the peripancreatic fat, we consider that as being resectable.
Okay, we'll move on to Dr. Barkun from McGill. Please define for us unresectable pancreatic cancer, no more, no less.
Well, Dr. Vollmer. I guess it's a question that it's more than any of the above. I think one of the issues that we have with pancreatic cancer is there's almost all the time more disease than we think there is. So I think the concept of resection and the concept of cure, which normally go together in our minds in pancreatic cancer, should be dissociated. I think that's where we tend to go wrong. So I think anything that's unresectable means, in my mind, anything that there's disease outside of the area of the pancreas. I would accept the concept that an R1 resection, an R1 resection really is a failed R0 resection, but if there's a possibility of an R1, I would accept that as part of resectable.
Okay, so you are making a very good point about dissociating our beliefs about the ultimate survivability versus what we can and cannot resect on a technical basis. Dr. Pedrosa, do you have any opinion about that? Unresectable disease.
Right. So from our point of view, I think it's a mistake for a radiologist to say that something is not resectable, because it will depend on the surgeon taking care of the case. But I think we can certainly show or indicate that there is evidence of local invasion. So I think occlusion of a vessel due to tumor is a definitive finding on imaging of local invasion. And I think encasement, complete encasement of a vessel with changing caliber is also, for example, a sign of local invasion, as well as the tumor standing outside the pancreas.
Okay. Dr. Allen, here's the hard part. Can you please accurately define borderline resectable pancreas cancer using these bookends?
Well, this would include all patients who are neither resectable nor unresectable.
All right, that's a perfect, succinct answer for us today. Dr. Delpero, what's the perspective in France or even Europe on this term borderline resectable?
We change over the past 10 years, and